time edition of our Investigating Research on Campus. I'm John Damra, Librarian for Access and Outreach Services here at the Mount. And on behalf of myself, Library Director Vivian Milzarski, and Dr. Ed Markover, Assistant Professor of Biology. Welcome for another great time to discuss and get into some conversations and learn more about the scholarship and interests and passions of our wonderful Mountain community faculty members. For people that are in the room, please make sure that if you have any phones, that they are on silent, that you have signed in if you have not already done so, and grab yourself something to eat over here. For anybody that's joining us via Zoom, you can go ahead and keep yourself muted. You can take questions through chat at the end, or you can raise your hand to unmute at the end. We are going to be recording today, and we have enabled live transcripts, so you can actually turn those on if you need some assistance with those down at the bottom. We've got those right here. Okay, so welcome to another edition here. I'm proud to be able to introduce one of our esteemed faculty members from the Division of Nursing. So Dr. Linda Kelly is currently an assistant professor in the School of Nursing, as well as the Service Learning Coordinator. She's been a nurse educator for the past 11 years, employed at the Mount for 5 years, with previous teaching experience in the community college setting. She's been a registered nurse for approximately 24 years. Her specialty areas include medical surgical nursing, neonatal intensive care nursing, neurological trauma and rehabilitation, inpatient and outpatient mental health treatment, and community health and wellness treatment for marginalized populations, particularly individuals diagnosed with severe mental illness and medical comorbidities. During her years in the clinical setting, she spent considerable time precepting and orienting new nurse graduates or new hires in a practice setting. So to present Mentoring Matters, Linda Kelly, please, thank you.
Hey everybody, thank you so much for being here. Thank you, John, and thank you to the iROC committee. Thank you for everybody who's on Zoom. So I'm really happy to be here today. I'm going to share my study. This was my dissertation study for on mentoring. And when we talk about mentoring, I think it's important to note that mentoring is not considered coaching. Mentoring is not considered precepting. It's really more a relationship. And when we are in nursing, whether it's in the practice setting or whether we are in the academic setting, we have a nursing theory, Patricia Benner, novice to expert. Everybody, I think, can relate to what that means, to go from being a novice to an expert. There is a huge path to enable to become an expert in any field. So for myself, what I found when I transitioned from the clinical setting to the academic setting, there's really a huge gap of information. We're not really prepared when we are clinicians and we are in practice to teach. We do teach patients, we do teach if we precept, but teaching to a body of students and teaching a curriculum is a totally different animal. So what I found was that with my own experience, both in practice and in the academic setting, that there was a real lack of true mentoring and how we can support our new novice academic nurse educators, because we certainly need them. Before I get into my study, what I wanted to mention is that right now we have a huge nursing shortage. So for those of us, we have a lot of our students here and our graduating students. You're not going to be without a job when you graduate from Mount St. Mary College. But unfortunately, we know that there are a lot of challenges right now in the clinical setting. The US nursing shortage is reaching a crisis level. Back in 2021, the American Nurses Association reached out to the US Department of Health and Human Services to state that we had this enormous crisis. And we needed to put some criteria in place and some services in place to kind of get us out of this crunch. There's a number of things that are leading to this crisis. We have had, this is cyclical. Nursing shortages are cyclical, so we can go back for those of us who have been in nursing for quite some time. We ebb and flow as far as shortages. Right now, one of the hugest impacts has been the COVID-19 crisis. I think we've all been well aware of what the challenges have been for nursing in the last 2 years. And nurses went from being healthcare heroes to now suddenly being stressed, burnt out, and really at a loss. So there's got to be some place in the middle, right? We need to meet in the middle. In addition to that, salaries are a problem. There is not equity in nursing. And also we have a lot of nurses, again, secondary to the COVID-19 pandemic, that are leaving the bedside and going into travel nursing. This has become quite lucrative. So what that's meaning is that we're leaving our home hospitals vacant, with a lot of vacancies. In addition to that, we have an aging nurse population. Those nurses, especially coupled with the problems in the last 2 years, have left nursing, have retired or left completely, left the profession. So burnout, stress, the mental health issues that our nurses are currently facing, all of these things are what the American Nurses Association and leading nursing organizations are asking our country to kind of step forward and help out our nurses. We need help. We know that nurses are crucial and critical for our healthcare system. So we really need to be also our own best advocates. If you take a look at this slide, not very different, right? This is a problem with faculty shortage. So if you looked at these variables, would you say that they're pretty similar? We have problems with, again, a major faculty shortage. We have certain specific issues that are related to nursing faculty shortages. One of them is, first of all, we need to educate our future nurses, right? So this is part of the pipeline. If we don't have enough nurse educators, we are going to lose capacity. We're not going to be able to staff those nursing shortages. The problem is that many of our nurses are facing challenges transitioning from practice to an academic setting. This again has to do with disproportionate salaries. When you are in clinical practice, your salary can be, exceedingly higher than what you would make as an academic nurse educator. So it's really a choice. It's really something that we have to kind of stand up and take a look at and realize that without that crucial piece of the pipeline, how are we going to educate future nurses? In addition to that, you require, especially if we're teaching at a four-year institution, a terminal degree, meaning a doctoral degree. Many nurses don't have the funding, cannot take on the loan burden in order to continue to educate themselves. So looking at where we can fund, additional education so that we can increase those terminal degrees, that is something that we need to look at as well. Workload, stress of an academic nurse educator is huge. We have academic requirements. We have professional requirements of tenure. We have clinical responsibilities. Many of us are still working in the clinical setting. So it leads to extreme stress and extreme burnout. So these factors that affect our nursing faculty shortage are very, very similar, if not exactly the same as what are facing our nurses in practice. What we have to realize is that also, it's not listed here, but COVID-19 was a factor for a lot of nurses who retired early. Our nurse educators are older. Many of us are coming into teaching after being in practice for 10, 20, 30 years. So we are aging. So we need to kind of be able to recruit and retain new novice educators. We also have tremendous faculty vacancies. So 74% of schools that are looking to recruit are having difficulty finding candidates for their positions. So when we take a look at mentoring, this has been something that the literature supports. Okay, so literature supports mentoring practice. Having mentoring in place, our nursing organizations, many articles have been written, studies have been found that say, yes, mentoring, this is what's going to help recruit and retain. What we haven't been able to determine is if it's in fact working, if those practices are in place. We know there's a lot of studies that have focused on what makes a good mentor, what makes a good mentoring relationship, right? How it might work, but yet those outcomes, there's real sparse information on the outcomes. So I decided that I wanted to see whether or not mentoring would have an effect on satisfaction and retention, because we know that those two variables go together, right? If you're happy somewhere, you're going to stay there. Okay, so retention has been a problem, keeping new, both in practice as well as in nursing education, in teaching. And then scholarly productivity is very important because we need to build the science of nursing education. We need to build the science of teaching and learning. So for me, that was a very important variable that I wanted to look at. So these were my three dependent variables, and looking at whether or not mentoring would have any sort of an influence. For my definition of terms, I think it's just important, again, to go back and say, mentoring is not so much a coach, mentoring is not so much a preceptor or someone who's orienting you, but this is a relationship. Okay, so if we take a look at these terms, these were taken from Connie Vance, who is a leading nurse educator. And it's if we talk about mentoring, it isn't a formal mentoring, it's an intentional relationship. So there's clear goals and objectives that should be coming from that relationship. Informal mentoring is unstructured, it's unplanned, it's unintentional. So again, depending on whether or not I was able to extract enough data from my collection, I wanted to be able to look at both of these variables. Obviously, no mentoring means no mentoring. Okay, you haven't been supported by anybody in particular on your career path. So this was my model. So I used Cram's conceptual model of mentoring. Actually, it's very interesting to note there are no nursing models for mentoring. So it was very difficult to kind of flesh out how I was going to look at these variables. If you look up at the top, that is discussing the relationship. So initiation, cultivation, separation, and then redefinition is kind of the pathway that relationship takes when you're working with someone, and then you kind of are going on that path from novice to expert. Career functions and psychosocial functions, the way I looked at this was, again, this was part of Cram's model, but I took a look at it and I thought, this is how I'm going to be able to ascertain whether those specific functions, career functions, are going to support scholarly work, scholarly activities, and then the psychosocial functions are really going to be looking at whether we were able to increase satisfaction. Were we able to increase the retention rates of those new novice academic nurse educators? So this was my research. These were my research questions. I wanted to look specifically at formal satisfaction, scholarly productivity, and retention, with whether or not mentoring had any influence. My target population was novice academic nurse educators working in a tenure track for anywhere from 2 to 5 years. So fairly new to academic practice. And also the schools needed to be accredited by the CCNE, which is the Commission on Collegiate Nursing Education, which is who accredits our program here. My instruments, I did a demographic questionnaire. Of course, that is important to collect, that demographic data: age, gender, where the person's working, what their level of education is. And then the other 3 instruments were specifically measuring my variables. So satisfaction, retention, and scholarly productivity. What was important to note in the demographic questionnaire was that age and gender there was some statistical significance there. And when we talk about age, again, the largest population of who was responding to my study, who met the criteria, they were between the age of 55 to 64. So those were our novice nurse educators. So you can see that we have an age discrepancy. When it was gender, where do you think the gender gap was? Anybody care to guess? More females. 93% female, 6.3% male, and then the other percent was other. And that went hand in hand with what we see in national statistics with surveys that have been put out by the National League for Nursing. So as far as how I collected that data, I did try to generalize it across the United States. So it was inclusive of all the regions of the country. And I systematically I used a stratified convenience sample where I was able to send surveys to specific schools in these specific geographic regions. So summary of my results, I received a total of 4,190. I sent a total of 4,191 invitations. I had 611 completed surveys returned to me. Out of those, I had 44% that met my sample criteria. So my sample size was 270. With prior power analysis, I needed at least a sample of 258. So I went beyond my sample size. I'm going to go quickly through these slides because they're a little boring. I don't want to bore you with my statistics, but this was my data collection, okay, for satisfaction, retention, and then scholarly productivity. To just put it in a nutshell, what I found that I had group means for satisfaction scores, I had significant statistics, significant results for informal mentoring. For retention, I had significant results for any mentoring, formal mentoring, and informal mentoring. So if you went back to what I had proposed or what I had hoped to find was that I did not find any difference on those career functions. So scholarly productivity, there was no difference. There was differences for retention and there was differences for satisfaction. So what's interesting to note is that informal mentoring had an impact on both, or had an influence on both satisfaction and retention. Yet in my literature review, what I had found is that most organizations and most studies supported formal mentoring. So that was interesting to me because then I felt that maybe that is an area that we need to look at, that maybe it's not so much that we need to focus on a formal mentoring process, right? But yet, what does it mean to actually develop a relationship without those constraints of having to do something and having to meet with someone? Because what also was found is that sometimes those dyads, those mentor-mentee dyads, they don't work. They don't click. Those individuals don't click when you're assigned to somebody. So it would, at least this study proved that informal mentoring did have a significant difference. In addition to that, then what I would propose to do was look at, because there was no statistical significance on scholarly productivity, perhaps just reaching out to those universities that are considered R1, where research is part of, and grant funding and funding research is part of your process. So maybe focusing on those schools maybe you would see a difference in that scholarly productivity. So that was my study. And then what I'd like to now introduce to you is how this kind of became part of my work here at the Mount, because I have such an interest in mentoring. It's not just important to mentor novice academic nurse educators. It's also important to mentor our students. And I have a number of students here that are part of our mentoring program. So when we can foster and instill the nurturing and the development of leadership qualities so that we can let a student see their full potential, that's really where my focus is and really why I do what I do and why I chose to be a nurse educator. So I've been privileged to have this program here, PALS. So what does PALS mean, you might ask? Peers Achieving Leadership and Scholarship. This was an acronym that I came up with former members of our Student Nurses Association back in the spring of 2019. This is when the program started. These are actually one of our first cohorts of students. If you see those that are down along the bottom, they've graduated, but we have one student up in the corner who was a freshman at this time, and she's now a senior, and she will be graduating. So we started this program in order to assist students to kind of see themselves on these. We're focusing on NFA North students at the time. What does it feel like to be on a college campus that's really in their own backyard, right? How do they see themselves perhaps looking into the future and see themselves as college students. So we wanted to provide that avenue. We wanted to provide that ability for those students to be here and kind of get a sense of what college life is all about. So that was begun in the spring of 2019. We enlisted the help of a number of our different departments here on campus. You can see on the left there, the Office of Student Success was part of this program where they would come, the students would come weekly, small groups of 8 to 10. They'd come into our labs. We'd provide some instruction, and then we'd also do a hands-on activity for them. Here you'll see our simulation director, Stacia, who was at that time providing the activities for the students. We have now transitioned. We have, unfortunately, logistically, we haven't been able to resume that program, but we had a wonderful opportunity to team up with NFA West internship program. This was developed through Ingrid Tavares through our C-STEP HEOP program. She was in contact with counselors there and staff there. And it's important to note that this program is already in existence here. The NFA West is already aligned with our Division of Education. So we're kind of like coming up the rear because the school told us that there were some students that were interested in nursing, and they are here with us today. So with the addition of those students, we were able to kind of brainstorm. We met in the fall of 2021 with our PALS coordinator, Taylor. I know she's here somewhere. And we decided to schedule this program. Well, this is something for the internship program. They come every week. Okay, so these 3 students come every week. We have multiple mentors. So we have a number of students from the School of Nursing that are working with them, and they have the opportunity to engage with our students, to engage with our campus, take part in discussions, take part in iROCs, and be able to see what it's like to be a nursing student here on the Mount St. Mary College campus. It takes a village. I would be remiss if I did not speak to the other divisions and departments and staff that really have been instrumental in providing support for this program. You can see here, these individuals have gone above and beyond and have been able to provide instruction to the students, discussion with the students, introduce them to the services here on campus. So I've really been pleased to be able to partner with all the different, facets of the college campus. I hope the students, I hope our NFA interns have benefited from the expertise of our staff here on campus. This is a sample schedule. So this was a couple of weeks ago. This was the actual schedule of what our mentors and the NFA interns, how they went through their day. So on this particular day, they met with Robin Rosenberg in the Career Center. They met with the Office of Student Success. And then they also went to a class. They went to a fundamentals course with our professor, Vera Rubio. So this is just a sample of some of the ways we structure the day and what the students have the ability to see and do while they're here. I can't say enough about our mentors. So some of them are here. These are amazing students. If there is that old saying, if you want to get something done, ask a busy person. These students are amazing. They are our mentors, but not only are they mentors, they're involved in the Student Nurses Association. They are resident assistants. They are athletes. They are employed. They have families. And yet they come every Thursday and they support and mentor the 3 NFA students. So I applaud them. This program would not be in existence without them, and they are the key to what makes this program work. So thank you all. It's important to note that we have representatives here from the senior class, the junior class, and the sophomore class. So I look at it as being able to provide peer mentoring. these students will pass the baton. They will provide the encouragement and support for those that will come after them. Isn't that exactly what we want in a mentor, right? Isn't that exactly what we would be looking for? So thank you, students, for all that you do. Here is our first day, right? You can tell times have changed, right? We were all masked. So this was our first day with the mentors and the interns. This was our introductory meeting. And so what has been wonderful is that during our visits and during these various Thursdays, we discussed the challenges of student life. And again, and it's coming from the mentor's perspective, so it's coming from the student perspective. I'm just a fly on the wall. I'm just there to observe and pay attention and take it all in and really listen to the wonderful wisdom that our students have to impart. The expectations for college are discussed. The interaction with students, faculty, and staff. So not just our mentors, we're out there, and you'll be seeing some other photos of the interaction of the interns. They're immersed in our programming. They're immersed on our campus. So what has been lovely to witness and observe is that how warm and welcoming our mentors have been, and they listen. So everything that they are providing to our mentees or to our interns is exactly what we would look for in the characteristics of a mentor. And it's happened organically. It's happened absolutely authentically. It's a genuine response. And that has been what has been a wonder for me to observe. So those traits are ingrained. Those traits are just blossoming with the opportunity for these students to engage with each other. So this next slide just gives you, again, a glimpse of what the students have been doing here on campus. I would say that our students are leading by example. Okay, they're teaching, they're discussing, they're showing them our labs, they're showing them our facilities. Our mentors have been instrumental. You can see here our interns have practiced putting on PPE, right? Something that nobody knew what that meant years ago except for nurses, and COVID-19 has certainly allowed everyone to know what that terminology means now. But having the ability to be hands-on and having our students be the teachers in what to expect as a nursing student, and then of course, as a nurse in practice. Here are more examples of our students interacting in our simulation labs. We've got our wonderful Carrie Ann Goff and Stacia Donaldson, who have been instrumental in providing the activities for the students for them to truly be hands-on. So I can say without a doubt that when the students are immersed in that experiential learning, that is really when they shine. And in our discussion this morning, I would say that they also reiterated that, right? Is that this is really what makes this program work, is that they're really enjoying these immersive experiences. Here again, Carrie Ann, who's also here today, with our students, sharing her expertise as a pediatric nurse and having the students utilize the equipment that we have in our pediatric simulation room. I think pictures are worth 1,000 words, so I hope that you all can bear with me, because I think that this says a lot more than what I can impart to you with my own words. This is interaction with my class, actually, the junior nursing students in their actual simulation scenario here on campus. So this was their take on an escape room. So the students were, our NFA interns were actually there in the class as if they were part of that process, and they worked alongside our junior students in trying to get out of this patient's room. So to conclude, what I'd like to say is that I think it's really important that we always remember that we were once a novice, wherever, wherever path we are, whatever discipline we are immersed in. And that path, when we think about trying to nurture those that are coming behind us, to have the patience, to have the tolerance and the acceptance of the learning curve, it's so important for our students to feel heard and to feel like it's okay to make mistakes or ask questions. That's part of the learning process, and we want to support them in that endeavor. I try to remember to be the mentor that I would have wanted. That really is what drives me. What did I need at these certain points in my life? What was important to me when I entered into practice? It's a scary time, right? It is a very difficult time, especially now. And we don't mince words with our students. We're trying to prepare them for what lies ahead. What is it? How do you recall what it feels like to feel lost or insecure or like an imposter? Imposter syndrome when you first are teaching in a classroom. That's huge. So whether we are mentoring our students, mentoring as a peer, mentoring our fellow colleagues, to always remember where you are, where you've come from, and where we all need to go. I want to borrow a phrase from NFA West, something that the students shared with me, that we have to allow others to grow and glow. I love that. I stole that, and I'm giving full credit to the NFA West internship program for that. I think it's a lovely way to end this program, and I thank you all so much for being here, and hope you've enjoyed the presentation.
So they can hear us. Okay. I think that works now. Very good. Thank you so much, Linda, for your excellent presentation. Does anyone have any questions for our presenter there? Microphone. Questions in Zoom? Watching for those questions. Yeah. So any questions that you might? I'm going to go ahead and ask you a question. This, I'm learning about the PALS mentorship program that you have for the. Like the first time today. So it's very new, but it looks like it's already been incredibly successful. Can you tell me a little bit about your process for identifying those students and how they were selected to be mentors? Part of the process.
Totally volunteer. Absolutely volunteer. So when I say that, when I talked about the students being very busy, the recruitment of the students is voluntary. It's totally on their own accord. So we do have the Taylor Ephraim, who is the PALS coordinator. So she is part of our Student Nurses Association. So she is the one that spearheads and is available for these students on a weekly basis. And in the past, the PALS coordinator did the same. Because we had the hiatus with the pandemic, we had a real stopgap with being able to provide this programming. We reached out to schools. We were trying to do virtual programming. We were trying to do things that we can engage, via Zoom. It's not the same. It's not the same as being on campus. So for those students many of them are here who are the mentors, totally on their own, free will.
To those students that are part of the program that are here, thank you very much. I might put you on the spot in a minute to ask you to share kind of your takeaway. Let me see if I do have some questions here in the chat. I'll go ahead and share. Not a chat, just some excellent comments. Dr. County Vance was one of my professors. Very good. Okay. Yeah. We've got some more people that are interested in the program, so we'll definitely get you connected with them as well.
Absolutely.
So any of our mentors that happen to be part of the process, does anybody want to share just a little bit about their experience with NFA students and how it went? Okay, that's all right. I won't make anybody do it. It's hard to be put on the spot, right? That's what you get from being here in the room. You get the brownies. Oh, excellent. Thank you so much. All right, I'm going to go ahead and.
It's been honestly a really great experience because I've had mentors in the past, like people who've already graduated, you kind of saw one in the pictures, but so I wanted to give back as well. So that's why I volunteered to be part of this mentorship. So that's why, I wanted to be their mentors and try to help them achieve and their goals and stuff, and kind of let them know that they're amazing coach, help them navigate through this program. Just the school and stuff as well, and that's basically why I volunteered to be in this mentorship.
We do have someone who wanted to make a comment. It's going to go ahead and unmute, so I'm hoping that's going to work. All right, Clint, go ahead.
Hello, hi, my name is Lakia Stoops. I am a school counselor from NFA West. I just wanted to thank Ms. Linda Kelly and the staff at Mount St. Mary College for just being so collaborative and supportive of our internship program and also for the mentoring component. I'm very grateful to all of the professors that we've had the privilege to work with, including Dr. David Gallagher, Alexis McBride, and Professor Joshua Patterson, in addition to the nursing staff and also the just amazing work, Ms. Kelly, you've been doing with our internship coordinator and advisors. I'm so glad that we have 3 students there. They come back just really highlighting the amazing work that's happening and all that they're learning. So on behalf of the principal, Ebony Clark, on behalf of our internship coordinator, Nina Jalbert, our advisors and myself, we thank you for taking the time to make such a commitment to the students here in Newburgh. So thank you so much to everyone on the call. It was a great presentation. I learned a lot, and I hope you all have a great day.
Thank you.
Thanks so much for sharing. Yeah, you've got a lot of fans, both from the people in the room and then from our comments in the chat here as well. So I do want to go ahead and thank Linda Kelly again for an excellent presentation here today. Join us again in 2 weeks for another iROC presentation. It'll be the last presentation for the spring. And then again, we'll have our poster session in May. So again, I just want to thank Linda Kelly. Thank you so much for joining us today.
Thank you.
Really appreciate it.
Thank you. Thank you, everybody. Thank you for coming.